Welcome to Emirates Specialty Hospital, Dubai Healthcare City. In this video, we'll be informing you regarding the Central Sterile Supply Department process and procedures in our hospital. Before any surgical procedure, the sterile pack will be checked properly with date, indicators, and integrity of the sterile pack, and it will be documented, including the patient details for proper tracking. Used or dirty instruments will be transported to the CSSD department in a closed container through the dedicated service lift. Proper PPEs as part of the quality standards will be worn at all times by the CSSD team before touching any of the contaminated instruments. The instruments will be received in the decontamination area by the designated technician. The receiving room is maintained as negative pressure at all times in order to avoid the spread of infection to other parts of the hospital. Once the instruments have been received by the technician, the contaminated trolley will be taken to the trolley washing area for proper disinfection methods to be followed. The technician will be inspecting the contaminated instrument set in a proper manner by using the detailed instrument checklist to make sure that the set is returned complete without any damage. Once the inspection process is completed, then the instruments will be moved to the manual cleaning area, where the technician will perform the proper manual cleaning process. After the manual cleaning process has been completed by the technician, as per the standard process, then the instruments will be taken to the automated washer disinfector for the complete disinfection process. The disinfected instruments will be received by another technician in Zone 2, which is the assembling and packing area. The instruments will be inspected again and rearranged properly by using a checklist. After the inspection and rearrangement process, the chemical indicator will be placed in the container in order to help the end users identify the sterility of the set prior to usage. The instruments will be packed and labeled with all the required sterilization details, along with the date of sterilization, expiry date, sterilizer details, and the technician details, as part of the process and standards to be followed. The packed instrument set will be moved by the technician to the sterilizer area for the sterilization process to be completed. After the sterilization process is done, the instruments will be unloaded in the sterile store. Then they will be dispatched to the patient care areas, through the sterile lift to the OR, and closed sterile containers to other areas of the hospital. Central Sterile Supply Week is celebrated during the month of October, and the CSSD department is a vital department in a hospital environment. It is managed by a team of professionals who have had several years of expertise in handling the process.